All right. Thank you all for joining us this afternoon. My name is Chris Delamain, and I am a consultant with Eustace Benefits here in New Orleans. And we've been working with MCS as of late, trying to come up with a strategy to obviously put a benefit plan in place that will give strong benefits to the employees of MCS here in Louisiana as well as on a national front. With the healthcare reform being in the near future, some of the plans that were available to employers are going to be either going away in the upcoming plan year or eventually going away as we move into 2015 and 16. So your grandfathered plan, although it would stay around another year or so, eventually it would move. And then your non-grandfathered plan, which was your high deductible health plan, had a possibility of changing in 2014 as well. So with that being said, we were trying to find something that was very robust and had a lot of good coverages for the employees, with trying to reduce some of that out-of-pocket expenditures that you have when you go to the doctor. So what I'm going to go through is 4 options that that we, along with the management at MCS, have come up with. And so you will have opportunities to ask questions as we go through these options. I'm going to send out this packet itself to Mark. Mark can then forward it on to the employees, and they're going to select which plan they want by signing your name and dating each plan, and then you can email that back to me. And that's how we're going to kind of tally who wants what.
Chris,
so before we get started, any questions?
I do. Can you hear me?
Okay. Sure. Yeah.
I didn't get to ask this, and I figured yes. When does this have? When's the deadline for that part of it? Because I know we're in the holidays right now, and then everything is effective the 1st. What's the?
It would be great if I could get this emailed out this afternoon. You could take it home, look at it. If you wanted to talk to your spouse, your significant other, on maybe Thursday when you're home together, and Friday, if you could get that email back out to me, I would like to have it back Friday.
Okay.
If that's acceptable for everyone. I know we're kind of under a crunch. Humana doesn't need these forms back Friday. I'm trying to get them back Friday because the sooner we get them to Humana, the sooner they can process everything and get you your cards in the mail. So we're going to be a little bit behind the ball. It's not like you're not going to have insurance. It's just you're not going to have that card in your hand as quickly as I'd like, but we will get you temporary cards in the meantime.
Okay.
So without further ado, I'm going to go ahead and go through these 4 options. And Mark, if I'm missing something or there's something you want me to be more clear on, just stop me at any time, and we can back up, stop, and refocus as we go. I do want to mention that there's going to be a core plan that MCS buys for all the employees, and then you will have 3 options to buy into. And each of them move up in price as they become more rich in benefit. Okay. The first plan we're going to look at is the first option, which would be the base plan, the core plan that MCS is buying for all the employees. This is the plan that, as far as premium goes, is the most attractive to you as an employee because there's no contribution to you. It's picked up 100% by the company. On this form that you're looking at here, we're going to go through these benefits on the left, and then each slide is going to have what the rates are here on the right-hand side.
Anyone else see it? It's not flipping the screen for me.
Do you see it?
I still see the open enrollment screen.
You do.
Does anyone else see the new screen?
Okay. I see the new one.
Yeah, I see the new one.
Mark. Okay, it's just me. Go ahead.
Okay. So this first plan that we're talking about is called the Humana Simplicity Plan. And the Humana Simplicity Plan is the closest thing to what we used to call back in the day as an HMO. Everything about this plan is driven via a copay. So there's no deductibles, no co-insurances. Everything is a fixed cost. When I use the term HMO, you're not limited to you're not limited to just a few doctors, and you don't have a PCP. What I meant is that it's a copay style plan. Humana's network is quite robust. It's a national carrier. It's going to give you probably some more options out there with regard to doctors than some of the plans that you had with Blue Cross, simply because Blue Cross of Louisiana is limited to the state of Louisiana, and then you're piggybacking off of Blue Cross's sister networks throughout the country. So this being a national PPO, you're going to have a very broad network. You will have access to Humana.com, where you can actually go in and search for doctors online. And there are a lot of online tools associated with this program, more so than you had in the past. So going through these benefits top to bottom, there is no calendar year deductible. There's no family deductible. There's an out-of-pocket maximum of $5,000 for a single and $10,000 for a family. Everything that you do in this plan is going to be driven by a copay. So if you go to the doctor, your PCP, or your internist, your general practitioner, for children it would be a pediatrician, it's going to be under a $40 copay. If you go to a specialist office visit, that copay is $65. Now, everything you do in those office visits is covered under that copay. There's no additional charge that you have to come up with. All of your wellness visits to a PCP and a specialist are covered at 100%. This is part of the Affordable Care Act. So when you go into the doctor for your annual checkup, if women go in for their annual exam, all that's covered at 100%. There's zero copay, zero cost that has to come out of your pocket. Some of these additional outpatient services that we're talking about here, like rehab speech therapy, physical therapy, since those are specialist office visits, they would be under that $65 copay. Anytime you have an X-ray inside of a doctor's office or something like that, some sort of a test, that'll fall under that copay as well. Now, if you do go into the hospital because you have a surgery or an outpatient surgery, there's a $700 copay per day for a max of 3 days. And you'll see that here and here. So if you go in for an outpatient surgery, it's $700, that's it, you don't pay any more. If you go into the hospital and you're there overnight, the most they can charge you is for 3 days, which would be $2,100. Keep in mind that this plan is unique in that all these copays of $40 and $65 all go up to this max out-of-pocket of $5,000. Okay? So every time you go to the doctor and you spend $40 or $65, it's tallying up to or reducing from that $5,000 max out-of-pocket. So if for some reason you went to the doctor enough times in a year and you went in the hospital enough to reach that $5,000, you wouldn't spend another cent in that year. So moving down here to like mental health services, that's since that's a specialist visit as well, that's another $65 copay, which does build up towards that $5,000. Any of the professional services and fees, those types of things are all covered under those copays, as well as the inpatient and outpatient services as well. You have a prescription drug benefit on this plan. There's no drug deductible. Your generic drugs are a $10 copay. Your preferred brands are $45. Your non-preferred brands are $90. And this is all driven by a formulary. So we all know what generic drugs are. The difference between preferred brand and brand name are that Humana gets a better cost or discount on those preferred brand drugs, so their copays are lower. So those drugs that are new to the formulary or are new to a patent, they're going to be your higher cost drugs, and those are the ones that would fall under that $90 non-preferred brand copay. Multi-source specialty drugs, injectables, 25% of the cost. Very few individuals use those drugs, and they're very high priced, and that's why they're a percentage of cost. There's also a mail order benefit with this plan, where you pay 2.5 copays for 3 months worth of drugs. So if you're on a maintenance medication that you take every day, annually.
Chris,
yes, sir.
Can you still hear me?
Yeah.
Is anybody else hearing? Because I'm getting some messages from people saying that they do not hear you anymore.
I can hear.
I can hear him.
Okay.
I can hear him.
We can hear at the call center.
All right. I apologize for interrupting. Bill,
Okay.
Bill said he lost his sound, and I think Cheryl said she lost her sound too.
Okay. I am recording this, so
Okay.
we'll be able to send it out or play it back.
You'll be
and
able
I
to
will
email it right at the end of it?
I think I will be able to. I've never done it before, but we'll see. And look, if anybody has questions after the fact, we can talk about this, one-on-one.
Okay.
So the mail that's okay. The mail order program with this policy is 2.5 copays for a 90-day supply. So as I was saying, if you take a maintenance medication that you go to the pharmacy once a month and get it filled, the mail order is the way to go. So instead of paying $30 for 90 days, you'd pay $25 for a 90-day supply if you were buying generic drugs on this plan. The emergency room is a $375 copay that is waived if you're admitted into the hospital. Urgent care is a $100 copay, and the ambulance is a $375 copay. So as you can see from this plan, there's no deductibles or coinsurances that you have to track, and everything accumulates to that $5,000 as I indicated. Anybody have any questions about this plan while we're right here?
What about urgent care?
Urgent care, if you go to are there Concentras in your area?
Yes, there's one.
Okay. If you go to a Concentra, you're going to pay the 40 or 65, depending on what type of physician you see. If you go to a non-Concentra urgent care, it's a $100 copay. And then these rates are here up at the top. As you can see, under option 1, if you're an employee, there's no premium contribution for you. And MCS picks up the full cost. Okay, I'm going to move on to, excuse me? I'm going to move on to option 2 now. Option 2 is a more traditional PPO, or a National Point of Service Plan, to be more precise. This is a more standard plan that you're accustomed to seeing. There's deductibles and coinsurance levels, max out-of-pockets, and copays as well. There's not as much out-of-pocket cost for an individual if they were to go into the hospital or have a lot of services throughout the year, but it's a little bit more to track as well. So under this plan, there's a $1,000 deductible. The family deductible is $2,000. The out-of-pocket calendar year max is $3,000. Family is $6,000. Your office visits on this plan are $30 and $55 to the primary care and specialist, respectively. Once again, your wellness costs on this plan, whether you're to a specialist or a PCP, are covered at 100%. Part of the Affordable Care Act. Those are one of the provisions that have been put into these plans. So once again, annual exams, children's checkups, immunizations for flu shots, all those things are covered at 100%. They don't cost you a dime anymore. Your outpatient services such as rehab and speech therapy, those are all going to be under a $55 copay because it's a specialist visit. X-rays and labs are covered under that copay. If you go into the hospital to have surgery, if you go into the hospital to have a child, if you go into the hospital for any reason, inpatient or outpatient, it's going to hit your deductible and coinsurance. So your deductible is $1,000, your out-of-pocket calendar year max is $3,000. So in any year, the most you're going to spend out of pocket if you go inpatient, outpatient is $3,000. The difference with this plan is these copays do not accumulate to this max out of pocket like they did on this plan that we looked at before. These copays go into Never Never Land. When you spend them, that's it. They keep accumulating. They don't ever deduct from that max out of pocket. Your inpatient services, as I mentioned on this plan, are 20% after your deductible. Mental health, if you go to see a provider, it's going to be a $55 copay, you're like a specialist copay. Inpatient facilities, 20% after deductible. Professional services, if you're inpatient, are all covered at 100%. This plan, as did the other plan, it has a drug card. This one's a little bit more rich than the last plan we looked at. This is a $10 generic, $40 preferred brand, $70 non-preferred brand, 25% of the cost for multi-source and injectable, and you still have your mail-order drug program, which is 2.5 copays for a 90-day supply. Emergency room on this plan is $250. Urgent care is a $75 copay. You can go to any urgent care center on this plan. And then ambulance is 20% after deductible, just like an inpatient service. So as you can see, this plan has some richer benefits, and that's why it's a little bit more pricey. If you look up here at the top, MCS is still paying the full cost of that first plan, the $306.43. The difference between those plans is $17.80 a month, and that would be your cost for an employee to buy up to this richer plan, which would be option 2. Any questions so far?
If you go to urgent care and get an X-ray, it's $75.
It's going to fall right. It's under that copay.
Okay.
Everything they do in that urgent care center is under a copay.
The professional service, is it covered 100%, or is it 100% out of pocket until the deductible?
It's covered at 100%. So if you were to go into the hospital and you pay your deductible and coinsurance, which for an individual would be $4,000. So if the bill was $100,000, the most you're going to spend is $4,000.
All right, thanks.
There's no additional charge for those professional services, inpatient or outpatient. They're covered under that facility charge. Okay, option 3, same type of plan that we looked at just now, except it's a little richer. This plan has a $500 deductible with a $2,000 max out of pocket for an individual. It's a $1,000 family deductible with a $4,000 max out of pocket. The copays are the same, $30 and $55. Your specialist visits, whether you go inpatient, inpatient specialist, are going to be $55, excuse me. X-ray and lab, as before, are covered under the copay that you pay when you go to the doctor. Once again, same coinsurance level of 20%. Professional services are covered at 100%. Same exact drug card as before, the 10/40/70, 25%, 2.5 copays for 90-day supply. So really, everything in this plan is the same except for the fact that your deductible and your max out-of-pocket is lower.
What's the most you'll pay for surgery?
Under this plan, if you go into a network doctor, it's going to be $2,500. Whereas before in this plan, it was $4,000. This one is $25,000.
What happens if you have 2 surgeries in 1 year?
That's your max. It says here, calendar year max is $2,000. So once you pay your deductible, you're done with your deductible. You're going to pay 20% of the bill to your out-of-pocket, $2,000. Once you're out of pocket that additional $2,000, you're done for the year. But keep in mind, as I mentioned in the first plan, that is the first plan we looked at, which is this one, is the only one that has those copays that accumulate to that max out-of-pocket. The second plan and this third plan, these copays do not accumulate to that max out-of-pocket. So although your inpatient charges are done, if you went to a follow-up visit with your doctor, you would still have a copay that you have to pay. And once again, this plan being a little bit richer here on your deductible and your max out-of-pocket, the cost of this plan is $63.32 to use the employee. MCS, the corporation, picks up the rest of the charge. And moving on to plan number 4, you're familiar with a qualified high deductible health plan. The high deductible health plan is an HSA style plan where you can contribute funds into an account, and those funds are used to pay for your medical bills. You have one of those now with MCS. This is one similar to that plan. It's a $2,000 deductible with a $5,950 max out of pocket. This $2,000 is part of this $5,950. So the most you're going to be able to spend is $5,950. And everything that you do in this plan accumulates to that $5,950. Because it's a qualified high deductible health plan, there are no copays. Everything is deductible in coinsurance. There's no drug card copay. Everything is deductible in coinsurance. The only difference with this plan, because of the Affordable Care Act, Obamacare, PPAC, or whatever you want to call it, your wellness visits to a PCP and to a specialist are covered at 100%. Mammograms, pap smears, male exams, children's exams, immunizations, birth control pills, all of that stuff is now covered at 100% because of the Affordable Care Act, and those are all the benefits that you get without any charge in this plan. Everything else is going to go towards that deductible and coinsurance level. As this plan is not as rich as the last two plans we looked at, the cost for this plan is $27.17 for an employee. Everything else is picked up by MCS. So those are the 4 options that you have available to you. I think they're pretty broad with respect to the benefits. Does anybody have any questions about those 4 plans that we've looked at?
I do.
Yes, ma'am.
For the employee and family, for any of the options, is the MCS employee contribution deducted off of the amount for the employee and family plans there?
It is.
So it's $800.
Yes. So that's. Yeah. So if you're, which plan were you interested in?
I'm looking at 3, but I think it says the same information for all 3 plans. So I was just curious if that $800 total for option 3 is with the MCS contribution already figured in.
It is. It is.
Okay.
That 802 is the true cost of that is like $1,108 or something like that.
Okay.
So that 306 is been deducted already.
Okay. Thank you.
You're welcome.
I have a question.
Yes.
If I am on insurance with my wife at her work,
Okay.
does this insurance pay anything? Does it pick up the difference between what my wife's does not? I know mine would be the primary, I guess. So I guess I would need to ask her insurance company. But we'll do just the opposite role. If I took coverage for myself and my family, and my wife also has insurance, her insurance would be the primary, and this insurance would be the secondary. Would it pay anything at all on?
Right. For your children, the older of the two of you would be the primary. So if you covered your children and your wife covered your children, whichever one of you are older, the primary policy would cover them. But in this day and I'm sorry?
We we don't have children living at home. It's just me and her.
Okay.
So
yeah, you'd be spending premium that you don't need to spend. Because this plan, a lot of the things in this plan are copay driven. I think by the time you coordinated benefits, you would probably be offsetting the cost in premium. Does that make sense? If by the time you figured out exactly what your wife's plan would cover, that this plan doesn't cover for you, you would have overspent in premium, covering four of you basically, instead of just you each having your own plan. So you'd be overinsured, is the point I'm making.
Okay, I guess I would need to pose that question to her insurance company then. If I'm in the hospital and I have a $4,000 bill,
right?
20% I would pay, depending on which of these four options, I would pay out of pocket, but then her insurance may come back and pick up the rest. But so I don't know without asking her insurance company. So I'm asking you, if she went into the hospital, then her primary insurance would pay 80%. Would this insurance company pick up the other 20?
I would have to see her plan. It depends on the type of plan it is. I don't want to say yes off the bat because I can't tell you that without looking at her benefits. But I can tell you that if for you to be on her plan, you're going to have to pay a premium, correct? Or they pay 100% of your premium too?
Well, I don't know. We're thinking about if this plan is better, we're going to change insurance companies. But I was just asking.
It's all based on what the premium is. So let's look at the first plan. Let's go to plan number 1. So for you to include your spouse, it's going to cost you $367.72 a month. Okay.
Right, and we're paying with less benefits.
So the point I'm making is that over a year, that's $4,000. If she's got insurance at work and you have insurance at work, the amount of money that you're paying for her premium, you're going to spend more in premium than you ever would if you went into the hospital, depending on the type of plan it is.
Right.
So back in the day when we had typical indemnified plans, kind of like number 4, where you have just deductible and coinsurance, it might have been beneficial for you to be on a plan at work and your wife's plan too, because then those two plans would coordinate. Maybe you could pick up some office visits onto your wife's plan, and then if you went in the hospital, your plan might be richer. You would use your plan in the hospital, and those plans would coordinate. A lot of that stuff has gone by the wayside because of, obviously, the cost and premiums have quadrupled where they were 15 years ago. So it's not as cost effective to have more than one plan because you end up being overinsured and the two don't offset.
Okay, I understand.
Okay. Any other questions? Okay, so what I'm going to do then is, let me see if I can pull up real quick what I'm going to be sending out.
One thing,
sure, go ahead.
For just a moment,
Absolutely.
so the employees know, there is a slight change as far as the way things are being calculated as far as premium goes, and I don't know the proper terminology, but just so y'all understand. But the premiums are, say, on average, going to be going down for the employee. And what I mean by that is that right now we're going to what is called, and correct me if I'm wrong, Chris, but composite rating. Is that right?
That's correct.
Which means that everyone, regardless of age, pays X premium, and then everyone, it doesn't matter any conditions, whatever, pays the same premium, and then same for spouse to add a family, blah, blah, blah. What the point I'm trying to make is that the premiums, even by switching to that, I could sit here and look at each individual and compare to what we were paying and what we are paying, going to be paying. My point I'm trying to make is that on almost 99% of the instances where the premiums are going down. So I can't, just throw out a number and say, the family's paying less dollars because it would have been based on your age and your all that jazz prior years. But
right.
Just as a note so that most everyone knows is that from a premium standpoint, everyone's premiums are going down on, on what you would pay for your family and what you would pay for, or just you and your spouse.
And that's what companies strive for. When Humana's threshold is down to 10 employees, Blue Cross's threshold is at 50. But most companies, as they grow, look for that composite rating because it's a blended rate. When you go to hire somebody new, you don't have to. Age is taken out of the equation. Family content is really taken out of the equation. It's more of a level playing field for everyone, and I think that's why it's better for the employees and the company because it's a blended rate. So what you see on the screen now is what I'm going to be. Mark, I'm going to send this out to you.
Mm-hmm.
And it's the same thing we just looked at, except for on these sheets, it's going to say I elect option 1, I elect option 2, 3, and 4. And if each person would circle which one they are, employee, employee spouse, employee and child, employee and family, and then just write your name here, sign it. You can scan it and email it back to me or fax it. Take a picture of it with your iPhone, whatever you want to do to get it back to me. I think the iPhone thing was pretty good. You did that earlier today for me, and it worked out great. I was able to print it, and it was fine. So I think this is the best way to do this. It's the least amount of confusion for everybody. Is that acceptable with you? Are you good with that?
I'm fine with that. The only question I do have for you is that if someone has a question beyond here that's more specific to their personal situation, is there a problem with allowing them to call you after this call to have a few minutes of your time to discuss any questions?
Absolutely. My cell phone is in the signature line of my email. Maybe when I forward this to you, you could just do a mass email to all you folks, and if they want to call me one-on-one today, tomorrow, if y'all want to call and share a Thanksgiving recipe with me on Thursday, you're welcome to do that too. I'm here to help, and so just don't hesitate to call.
I have one quick question.
Yes, ma'am.
Is this plan, does it cover eye or dental care at all? Or is that part of the deductible, or no?
Yeah, if under these plans with Humana, if you have an eye injury or if you have retinopathy due to diabetes or something like that, you can go to the eye doctor and get your eye examined under a copay. This plan does not have a vision benefit per se for preventive annual checkups, things like that. But Mark, if that's something you're interested in looking at and folks want to look at that.
That's what I was going to say. That was the next point I was going to make is for those that we've discussed some about the vision and dental plans that will be possibly available. Those are still being looked at, and we're going to propose all that after. This one was time sensitive, the insurance for the Obamacare reasons. So that's the only reason we didn't present all of it. Yes, we are still looking at the vision and dental with Chris, and we're going to get all that in line after this is solidified. We were on a time deadline for this one. And I was just going to say, I do apologize to everyone about it being a call today and get it to me by Friday, last minute. We were trying to leave our options open, and for lack of a better way to put it, Blue Cross drug their feet on getting us some premiums because we were at least giving them the opportunity to see if we can get a good plan with them rather than switching. And, come to find out things are going away and things are changing. So I do apologize about this being a last-minute decision deal, but it just came down to what it was, and hopefully everyone understands.
I think you'll be happy with the Humana plan as well. Humana has a part of its health plan called Vitality, and if you're interested in wellness, if you're interested in tracking the things you do with regard to working out, if you're a runner, if you do walk in the afternoons or anything, you can sign up for Vitality through Humana, through their website. If you go get a health risk assessment done, which is you go to a Concentra center and you do your body mass index, they do a blood draw, a finger prick to check your cholesterol, your blood sugar, blood pressure. If you do all that stuff, Humana will send you a pedometer, and you can track your steps, and it's pretty cool. It's an award-winning wellness program that Humana gives its customers, and we'll have some more education on that as we move forward. But if you're interested in wellness, if you're interested in personal health, it's a great tool to have and utilize.
Chris, could you put option number 1 back up there, please?
I can.
I just want to take a snapshot. Thank you.
Sorry, let me open this back up.
Chris, we're gonna get these different options before we select them, correct?
Yes.
And what happens if I select option 1 and then decide to go to option 2? Do I have to wait to change options, or can I change options at any time?
I'm glad you asked that, AJ, because that was my next question: is is it similar to open enrollment, or can we change at any point?
Yeah, if you elect option 1, and in 3 months you want to go to option 2, you're going to have to wait to open enrollment.
Unless there's a qualifying event, correct?
Yeah, but I don't know.
We don't know for sure.
For an individual, I don't know how you could have a qualifying event to change coverage types.
To change. You're right. Okay.
Yeah, you would once you elect this plan, you're going to be stuck with it for a year, for lack of a better term.
Are we going to be able to go to a website and follow everything that's happening with us?
Absolutely. You mean like your EOBs and everything?
Yeah.
Absolutely. And Humana that's one of the things that Humana is cutting edge with regard to technology. You'll be able to pull your EOBs. You'll be able to track if you have an HSA. If you do want to do an HSA through Humana, and we decide to do the funding and all through Humana, they can track that for you. Your prescription drugs, everything is done online, and it's a very robust website. And I challenge you to go out and look around and kick the tires a little bit, because I think you'll be impressed compared to what you've had, especially.
Okay, thank you.
And I want to stress that we here at Eustis don't recommend carriers based on their website and their rates. We recommend carriers based on their fit for clients. And Humana is a company that right now is doing everything right in the post-healthcare reform world. Some of the carriers, some of the clients that we have with Humana, Xavier University here in New Orleans, the New Orleans Saints, the football, the organization, was a Blue Cross company, and they've recently moved to Humana along with the Audubon Nature Institute. So there's some companies with big names out there that have elected to use Humana because they're a good fit. Their pricing is right, the benefits are strong, and good for their employees. So they've elected to go with this carrier. So I want you to feel like you're in good company with other companies that have elected to use Humana as their benefit provider. So with that being said, I will get this email out. All my contact information will be in that email for Mark. And don't hesitate to call me if you have any questions, concerns, and if you want to talk a little bit more about these different benefits. I'm here for y'all if you need me.
Greatly appreciate your time, Chris.
No problem. and we'll catch up. Mark, I'll catch up with you tomorrow, or you're welcome to call me this afternoon if you want to chat about anything. Great, thank you.
So
Okay.
Upload that video recording to us some kind of way.
I'm gonna
Mark and distribute that.
Absolutely.
Okay.
Okay, guys. Thank you. Okay.
Bye.
Bye-bye.